the legislation would add 4 more members of the board, public members of the board, 2 appointed by the Senate President directly, 2 appointed by the Assembly Speaker directly. That means there would be 4 gubernatorial appointments and 4 legislative appointments. And it would bring the board back to an 11-to-8 balance. Still, more members appointed by the chairman than by the public, but it would make it a much closer vote on those things, and would bring 4 new sets of eyes to the board to question things and to challenge and demand answers, where right now the overwhelming majority of that board is appointed by the chairman and they're under his thumb. No question about that. On transparency, we're talking about a number of different things that would now have to be put publicly on the website. Compensation that's being paid, response time, things that the public has a right to know since they're paying for so much of what goes on at Horizon. They have a right to know these things. And if you try to get some of that information now from Horizon, it's a labyrinth. The public can never get to it. Some of it's absolutely withheld. And you can see right now they had a Supreme Court case yesterday where they were arguing that they should not have to reveal in the Omnia plan why certain hospitals were designated as Tier 1 and others were designated as Tier 2. They say, this nonprofit public insurer is saying, we don't have to tell the public why your hospital is a Tier 1 hospital, which is in the network, and you get lower copays, but Charlie's hospital is a Tier 2 hospital, and he's going to have to pay higher copays if he goes to the hospital closest to him. And folks are saying, well, we want the rationale as to why. They were arguing before the New Jersey Supreme Court in the last day or two. They shouldn't have to reveal that information. And so these actions of greater transparency and greater independent governance, I think will lead to a better operation there, and certainly an operation that's more responsive to the public, that provides them with 55% of all health insurance in New Jersey is written by Horizon, and over 50% of our Medicaid population is handled by Horizon. They should not be able to operate in the dark.